So question 4, tanning bed's a safer way to tan. This has to be a resounding no. And the great thing is there are all these new accelerated beds that have these high pressure systems in there so they can really deliver that tan for you in a much shorter amount of time. Well, tanning beds aren't safe. Forget the the skin. Look what it does to the eyes. These are cataracts. Okay, this is why when you go into a tanning bed, they give you those little goggles to wear, and then you don't know if then no one checks to see if you're wearing them. How about the people who are in the tanning bed, they'll lift the goggles to look to see if they're turning red or not, and then put them back on. They're getting that high dose of UVA right into their eyes. So they're going to see cataracts at an early age. The same if you have blue eyes, green eyes, and you go outside and you squint in the sun. Squinting is your protective mechanism of saying, hey, my eyes are letting too much of that light in, and you've got to be careful because you can actually burn and damage your eyes as well. And if you think I worry about melanoma in the skin, the eye doctors worry about melanoma in the eye, and that's a very highly dangerous skin cancer that they come across in the eyes in their practice. So what's the ugly truth about tanning beds? It's got to be all visual. If I just come up here and talk, I'll put everyone to sleep. It's a $5 to $6 billion industry, depending on which source you look at. There's a lot of money to be made in tanning. And it's going to keep me in business forever. But that's not what I want. I mean, I truly would like to see patients coming in and having things that are done now to make them look better as we intrinsically age and not trying to correct all the damage that's been done. But the newer systems, these new lights, can deliver 12 times the annual UVA dose that you would get just going out in the sun alone. So you can just go out on sunny days and be exposed to a little light, or you can go into one of these beds, pay money, and have your skin fried 12 times as much. 30 million people tan indoors in the US. 2.3 million of them are teenagers. Prom season, right? Everybody wants to look good for their prom. I agree wholeheartedly with the American Academy of Dermatology that these devices should be banned from non-medical uses. We use them to treat medical conditions. We use them to treat psoriasis, severe eczema, and certain conditions like that. That impacts the patient's quality of life, but that patient knows they're trading their risk of skin cancer for treatment benefits.